Talking to some of those worst affected by the blast.
The explosion here has unleashed a new fury on the streets. Even among the tear gas, these protesters, they've brought down governments before and there's been little change here. A reshuffling of the same old faces at the top isn't going to solve Lebanon's crisis. The state is out in force in a shattered capital, carrying guns though, not brooms. The Lebanese are famous for their determination, but people here are sick of being left to fend for themselves.
Nobody else but the youth is going to help here, and like as you see, you can see some people from the government here, and they just sit and do nothing.
It's not fixing. Like, we do revolution, it doesn't help. We become more aggressive, it won't help either. So it's like, so what can we do other than clean at the moment?
Some bonds in Beirut remain unbroken. Naji Massoud lived in this Beirut flat for 70 years, just 2 blocks from the port. He and his wife were here during the explosion.
This is our kitchen.
Most of their doors and windows are gone. Is it time to leave, I ask?
No. I stay with the tent here.
Jumeirah is a tight neighbourhood. A dozen people died on this one corner, and everybody here knows exactly where their neighbours were when the blast hit. But some are in no position to help. Their wounds are too raw. Romy Zarkour Loré was in her car on the highway by the port. She and her husband filmed the fire before the explosion.
When we arrived to the Hotel J hospital, it was like a movie. I had more chance than others because I saw that people on the road, people lost their eyes.
Today she's having plastic surgery. This disaster brought the Lebanese people together. But it's also tearing the country apart.
That report by Quintin Somerville, and it also emerged this morning that Lebanese security officials warned the Prime Minister and the President last month that the ammonium nitrate stored in Beirut's port could destroy the capital if it exploded. 2 weeks after this warning came, the chemicals ignited. There was high drama at the White House a few hours ago when President Trump was briefly escorted from a news briefing, only to return minutes later saying that an armed man had been shot outside the building's grounds.
There was an actual shooting, and somebody's been taken to the hospital. I don't know the condition of the person. It seems that the person was shot by Secret Service.
Meanwhile, the president is firing back after a fellow Republican called his executive actions to provide coronavirus relief unconstitutional slop. The Nebraskan Senator Ben Sasse is the first Republican to publicly criticize the orders, although other top politicians agree these types of decisions shouldn't be the responsibility of the president. But they only came after weeks of failed negotiations in Congress as millions of Americans struggle to pay their bills. CNN's Jeremy Diamond reports.
Today, confusion and uncertainty for millions of Americans waiting on help from Washington.
We think it's going to be very rapid. We want it to be very rapid.
2 days after President Trump signed an executive action promising $400 per week to out-of-work Americans, the White House is shifting responsibility to the states.
We hope to see it quickly and close to immediately. I don't have an exact readout for you on time, but a lot of this will depend on states and them applying.
And blaming Democrats for any delays in the president's new program.
Any delay that does exist, it's important to note where that delay and the responsibility rests, and it's with Nancy Pelosi and Chuck Schumer.
And beyond delays, many unemployed Americans might not see any new money unless their governor agrees to pay a quarter of the costs and administer the new benefit. Many states already cash-strapped amid the pandemic, unable to chip in and caught off guard by Trump's proposal.
If he thinks this is a resolution, this only makes the bad situation worse.
Trump also facing criticism from within his own party. today firing back at Republican Senator Ben Sasse, who called Trump's executive actions unconstitutional slop. Tweeting rhino, or Republican in name only, Ben Sasse has gone rogue again. And while Trump took a victory lap this weekend,
we've gotten much of what we've wanted without having to give up anything. And that's very good. You can't beat that.
Treasury Secretary Steven Mnuchin suggesting the administration is still in a deal-making mood.
We're prepared to put more money on the table. So there are things, as I said, that made sense to compromise. We've compromised. If we can get a fair deal, we'll do it this week.
The president claiming his unilateral action is bringing Democrats back to the table.
The Democrats have called. They'd like to get together.
But the Democrats baffled.
Fables from Donald Trump. Fables. That's what he seems to specialize in.
That report by CNN's Jeremy Diamond. The woman challenging the man dubbed Europe's last dictator is demanding a recount of yesterday's election in Belarus. Officials say Alexander Lukashenko won an overwhelming majority, but Svetlana Tikhanovskaya and hundreds of thousands across the country don't believe it. There have already been thousands of arrests as protesters and riot police clash in the capital Minsk. One protester has so far died. The BBC's Sarah Rainsford reports.
The protesters are gathering again in Belarus, the police too, in big numbers. Last night they used stun grenades and rubber bullets against the crowds. For 26 years, an authoritarian leader has limited freedom and jailed his critics, but guaranteed stability. Now Belarusians are demanding much more, angry because they say Sunday's election was rigged. In his first comments after claiming a landslide victory, Alexander Lukashenko vowed that there would be no revolution. People should pipe down, he said, and calm down. He claimed the unrest was being fomented by enemies abroad. His relations with the West had warmed lately as they cooled with Russia. But it's President Putin who's congratulated Mr. Lukashenko on re-election. The EU has condemned the violence.
About 3,000 people were jailed after yesterday's demonstration.
Svetlana Tikhanovskaya only ran against Mr. Lukashenko when her husband was barred from the elections and then arrested. Today, talking to the BBC, she said she refuses to accept the official results.
Frightened, really. I'm scared, but I can't stop now. I see how much our people want these changes. They don't want this pressure from our government anymore.
Across Minsk, key sites have been blocked by police and the internet jammed to stop crowds coordinating on social media. But they have come out in any case, calling once again for change.
Sarah Rainsford reporting there, and the State Security Service in Belarus says it has thwarted an attempt on the life of Svetlana Tikhanovskaya without giving further details. Her whereabouts have been unknown for the past few hours. From today, face masks have become mandatory outside in Paris and around the capital as France struggles with a spike in coronavirus cases. But as the BBC's Mark Lowen reports, not everyone is happy wearing them.
France is extending rules on the obligatory wearing of face masks in order to try to reduce its coronavirus infection rate. So from today, in 100 locations in and around Paris, you have to wear the mask outside. Now, it's already the case here in Nice and in several other cities, where in the centre of Nice between 10 a.m. and 1 a.m, you've got to wear the face mask. If you don't, you risk a fine. But if you look around, there are quite a lot of people at the moment still not wearing one.
I don't see many locals wearing them, like not everybody, so we're just we've got them in our bags, we wear them inside places and stuff, but not when we're walking about, really.
But do you know that you have to now, under rules, that you could be fined if you're not wearing it in the
I
old
better
city?
put it on then.
You're not worried about the rise in cases?
No, not really.
But you know you risk a fine now, vous risquez une amende.
Yes, I know, but I take the risk. I thought that I had to wear a mask just in closed spaces.
Also in the outside in the centre of the city.
Oh, I didn't know. So put a mask on. Thank you so much.
Thank you. For now, police have been told to be lenient, but to toughen up with fines in the coming days.
That was Mark Lowen in France. And that's World Watch for today. I'm Max Toll. Back to you, Marnie.
Thanks, Max, and that's Midday Report. Te Purongo o Te Potutanga for today, Tuesday, August the 11th. We'll be back tomorrow, of course, with interviews and the latest news from Aotearoa in the world. But for now, from the Midday team, kia pai, tō ra.
You guys come forward up here. Let's got our interpreter here. Hang on. Oh, kia ora koutou katoa. Welcome to Cannons Creek. It's absolutely lovely to be out here today for this afternoon's stand-up, and thank you so much for making the effort to come out and join us. I just want to introduce who I've got with me here today. I've got Rachel Haggerty. Rachel's the Director of Strategy, Planning and Performance at Capital and Coast and Hutt Valley District Health Boards. And I've got Dr. Sean Hanna, who is the Clinical Director at Oratoa PHO, and we're here at one of Oratoa's clinics, and in fact standing in their CBAC or their swabbing centre here out in Cannons Creek. So I just want to acknowledge the staff who I've just been having a lovely time getting to know here, who've been working right through the pandemic, swabbing up to 40 people a day in the centre here, really contributing to the effort in this community, very important part of our overall strategy. Now, fortunately, I have been well so far this year, so I have not been in a position where I have required a swab. But Dr. Hanna has kindly recommended that I do have a swab today, and so I will be making myself available for a swab after this, and if you're interested in checking with me what that was like afterwards, I'm more than happy to provide some commentary. Just to demonstrate what that actually involves, and it's what we've been talking about to all New Zealanders right through, but particularly at this time. We've talked about not being complacent, and our swabbing and testing across our community is a really important part of our overall elimination strategy. We want to know if there is a case of COVID-19 that does sneak through the border, that we find it quickly and that we get onto it immediately. So for any of you out there who do have symptoms, seek advice from your GP or via Healthline about getting a swab. Just in terms of the numbers today, there is one new case of COVID-19 in New Zealand. This is a case in managed isolation. And so it's now been 102 days since we last had a case of COVID-19 in the community that we didn't know the source of. Today's case is a man in his 20s who arrived in New Zealand on the 30th of July from Melbourne. This person has been in managed isolation in the Grand Millennium Hotel and actually tested negative around day 3 of his stay, but has tested positive on the day 12 testing. And again, this emphasises the importance of testing twice during that 14-day managed isolation period. There are some people who do not test positive in the first few days, and so that's why we have that day 12 testing and the requirement to return a negative day 12 test before people leave managed isolation. So our total number of cases now of COVID-19, confirmed cases, is 1,220, and we will update the WHO on that number. And we have 22 active cases in New Zealand at the moment. They are all in managed isolation or quarantine facilities. None are receiving hospital level care. And yesterday our laboratories processed 1,874 tests, and of those 522 swabs were taken in managed isolation and quarantine. We often see a lower number on Mondays, and we will be letting you know in the next day or two where we're going to have pop-up clinics in a range of DHBs around the country this week. You could see last week the value of those pop-up clinics in terms of getting the community numbers of swabs increased, but also in just raising the visibility and profile of the importance of swabbing. I wonder if I could hand over to Rachel and Sean just to make a few comments about the experience of the DHB and the PHO over the last few months.
Thank you, Ashley. Just really want to talk about what it is at a district health board with regards to coordinating our CBACs and our primary care testing centres. So in the Greater Wellington region across Hutt Valley and Cape Coast, we had 11 testing stations, CBAC testing stations, plus all of our primary care, and 4 mobile teams during the height of the testing process. We still have all of that infrastructure available to us. There are currently a smaller number of CBACs, including this one here at Oratoa, and designated primary care practices available to test people. So we tested thousands, tens of thousands of people during that time, and we continue to have that availability to us. Really encourage people who are symptomatic to call their GP or to call Healthline. Many of our practices, even if you're not enrolled, will be able to provide you with that test, and that's a really important part of us protecting ourselves from the risk of COVID as we move forward. So essentially for us, the importance of primary care in places like Orotoa, not only for testing but also for providing support to our families and to our whānau. So as Sean will talk about shortly, all of the social support, the ability to provide psychosocial backup, as well as general wellbeing and healthcare throughout all of the different alert levels, but remains important to people, particularly as we go through the aftermath of the lockdown and what we're dealing with now. So thank you. I'll hand over to Sean.
Kia ora no tātou katoa. Sean Hanna's my name. I'm a GP. I've been working in this community for nearly 20 years. And I guess what really came to the forefront during lockdown and subsequently was the cohesiveness of particularly this community, but also communities around New Zealand. Our iwi Ngāti Soa and our health and social support staff were active in reaching out, I guess, to our older people, to people with health and disabilities, people who might not have the supports that they would have, particularly during lockdown, to make sure they had food, to make sure that they had firewood and that were warm, and if they needed help, that they were connected to their community and that health was forthcoming. So just a wonderful time to be delivering health services, I suppose, and made me really proud to be working here in Porirua. So this is a CBAC. It's like a drive-through type setup, and it was really important for us to be able to look at everybody in the car when people were coming through. So we lots of CBACs had nursing staff and other swabbers, but we also had GPs. So we were able to deal with kids' skin infections. We were able to give flu vaccine if it was indicated, as well as COVID swabbing or treating whatever was needed, really. And in the process, I guess we were keeping people with respiratory symptoms and viruses away from our medical centre, where people without infectious diseases were able to access healthcare. So, yeah, kia ora. Thank you.
Well, thanks, Sean and Rachel. And you're most welcome to direct questions to the pair of them as well once I finish up. I'd just like to give you an update on our flu vaccination campaign. I know there's interest in that at the moment. So during the 2020 campaign this year, we have distributed a record amount of flu vaccine. 1.77 million doses have been distributed to date. I think this is particularly pleasing given the program did face challenges through both disruption to international supply chains. We had an increase in demand, of course, because of the interest in people avoiding getting the flu, and we were wanting people to get vaccinated, and also there were impacts on our national distribution. So saying, it's very satisfied that more people have been vaccinated than ever, despite those challenges, and I do want to thank all the staff. Sean's mentioned some of them, but all the staff across our system, including in general practice, but also occupational health nurses and those in other settings, pharmacists and so on, who have contributed to that record high level of flu vaccine. There were some temporary supply disruptions at the peak of the vaccination season, and that certainly caused some challenges and some angst for some of our practices around the country. We worked very closely at the time with DHBs and others to redistribute vaccine where we could, and it's pleased that in spite of those challenges we have been able to get this high level. And I should say we still do have vaccine available in the country, and there is still great merit in people who haven't been vaccinated in getting vaccinated. Now, sometimes we see a late peak in the flu season through into August and September, so there is still benefit from being vaccinated, and if people haven't had a flu vaccine, please do go ahead. And I guess just a final comment, we are already planning possibility of a COVID immunisation campaign, of course, and whilst there's still a lot of uncertainty about a vaccine, whether and when a vaccine will be available, and when New Zealand might get access to that, we are not sitting idle. We have work well underway to look at how we could deliver that vaccine across the population, and of course that includes learning from our experience with our measles outbreak last year, and also the issues that were identified this year in our influenza campaign, and trying to deliver vaccine and distribute it around the country when things were disrupted. So I'm happy to finish there and welcome any questions. Well, we didn't falter on our message about that. The important thing is for people to be vaccinated. It didn't require everybody to be vaccinated on the same day. I wanted to be consistent about the message. Yes, we knew there were some distribution issues, but we were also working carefully with our district health boards where possible to redistribute vaccine. And I think what we've seen is the consistency of that message about the value and importance of having a flu vaccine has led to a record high number of vaccines. I don't think there was a discrepancy. We've gone back and looked at what we were saying. We were clear about the challenge with distribution. We always had enough vaccine in the country, and there still is vaccine available, as I've said. So we had gone to great efforts, and Pharmac, I think, had done a good job in ordering those extra 300,000 doses. We then got additional Northern Hemisphere doses just so we didn't run out and still have some of both of those still available. So we were consistent in acknowledging the distribution issues. We were consistent in our messaging about the value of getting a flu vaccine, and we worked really hard with all the partners to make sure we could redistribute where possible.
We have those emails showing that Pharmac warned there was very low stock. We've got people saying that we need to suspend orders until we can't be delivered.
So again, without wanting to split hairs here, we had a lot of vaccine. At all points in time, we had more vaccine distributed to the sector than we knew had been given. And so, yes, we had at some points low stock centrally. So we put in place measures to ensure that that was distributed fairly around the country. But we did know there was vaccine around the country in a range of places. And many DHBs were able to work to redistribute that within their rohe. I can recognise their frustration, and I acknowledged that at the time, and in fact spoke with a number of them to get right to the bottom of what the issues were and do everything we could to address it. But again, I just want to come back. We have vaccinated more people than we ever have. We still have vaccine available, and I think that goes to the heart of the effort that was put in by general practice and others to ensure people were vaccinated. That's not the message I've had from many GPs. Thank you on that question here. Okay, thanks. Well, the 4,000 is what we would get if we had good levels of community testing, and if we were doing our day 3 and day 12 testing in managed isolation and quarantine, as well as our testing of our managed isolation quarantine staff and our border staff. All that testing is happening, and on some days it is lower. One of the things that's been really pleasing to see is people in the community have, I think, heard the message about the importance of testing, and we did see through the latter part of last week a number of days and into the weekend where we saw the testing volumes up around 4,000 and even 5,000. So it's really pleasing to see. It will go up and down each day, but our aim is to get around 4,000 average per day. Oh, do you want to comment on that, Sean?
So pretty much any sort of flu-like illness. So if you've got a runny nose, if you've got a fever, if you've got shortness of breath, if you're coughing, go contact your GP or ring Healthline and we can arrange a swab.
Oh, it has from when we first learned about COVID. You'll recall that right at the start, the case definition being used internationally was actually very narrow, and it related to fever, cough and shortness of breath, and the fever had to be above 38 degrees, so it was quite significant. But as we've learnt more, and of course one of the other really significant symptoms that people have when they do have COVID-19 infection, we do know, is this loss of smell and taste. And so as more was known, we extended the range of symptoms, but as Sean said, at the moment it's a very low threshold, so a runny nose, sore throat, cough, cold, fever of course, we'd recommend anyone seeks advice about getting a swab. So I don't have the detail yet. What I just wanted to let people know was, even though there's no vaccine yet been tested and confirmed or in manufacture, we are starting already on our planning about how we might immunise the population and about which groups we would do first to actually get the most benefit for New Zealand. Yep. I've actually been asked. I don't have any COVID-like symptoms. I'm very well today, but Dr. Hannah's kindly recommended I have one, and it's partly just to show people what's involved, because there are, some people do find it a bit unpleasant. I'll be able to give a readout on that, and also, I'm not expecting anyone to do anything I wouldn't do myself. Yes, and in fact we're working really closely with our rest homes. We did a review with them, and our response, the action plan in response to that review was published just last week, and we're working very closely with them on not just PPE availability and use, but all their infection prevention control procedures. And one of the reflections I would have as we look around the world is this is clearly a setting, as we found, that is very vulnerable. And it was only by virtue of the fact that we worked incredibly closely with aged residential care last time that we were able to limit the number of infections in those settings and the number of associated deaths as well.
And are you able to give us a general number of the amount of PPE that would be available for rest homes?
Oh, well, we would be supplying them with the PPE that they needed. We have very good stocks of PPE, and that is available, as we did in the earlier part of the year, to be distributed to all our healthcare workers, including those working in the community, so going out and visiting people in their homes to provide support for people with disabilities or with older people. I don't have numbers for the PPE at the moment, but we have a large supply. We have more coming in all the time, and also our national distribution system, which towards the and I think the Office of the Auditor General acknowledged that once the Ministry had taken over that and worked closely with DHBs, that was getting PPE to all our healthcare workers.
And lastly, the World Health Organisation is publicly praising New Zealand for its 100 days for emission-free. What's the message there?
Well, I think the message I get back from colleagues at WHO and around the world is because we're all interested in learning from each other, and also it's very important in a pandemic like this, that people have hope that actually if you do the right things, you can get on top of this virus. So I think countries look to New Zealand with hope, but I also have seen those reports reminding us, as we are reminding ourselves every day, that we cannot afford to give an inch, we cannot afford to be complacent. So it's nice to have hit the milestone, but we want it to continue, and hence, we need to be constantly vigilant. That was, let me just check here, that was in the Grand Millennium facility. Now, the person, of course, as we always do, is now transferred to the quarantine facility in Auckland. Are there any questions for my colleagues here?
Yes, unfortunately. So I think it goes back to what Dr. Bloomfield was saying about this sense of complacency. We don't have to look very far past our borders to realise that COVID-19 is still here. And it's, I think, part of our responsibility as New Zealanders that if we're asked to go and get a swab, then we, put our nostrils on the line, as the Director General's about to do in a moment. I guess it's maybe that they've had one before, maybe their friends have and they haven't liked that experience. There's lots of rumours around the place about it being an unpleasant experience. I mean, I've had a number of swabs, and a number of my colleagues who've got smaller kids than I have had a lot of swabs as well, and I think it's our responsibility, I think, as New Zealanders to step up and do what's advised for the benefit of all of us. Yeah. No, people are coming in with respiratory symptoms and coughs and colds, and then we're suggesting, or we're saying, hey, we better do a COVID test. So it's not being publicly given? No, I think like a lot of people, we're back to normal, aren't we? And we're doing normal things, and we're catching normal colds. But it's really, really important that we're swabbing lots of people to make sure that those normal colds aren't chains of transmission of COVID-19 in the community. Yeah.
I think one of the things I would add is that the test is free to people, so people are often used to having to pay a part charge when they go to general practice. So all COVID tests are free to everybody in New Zealand, and that's important too, because we understand that that might be a barrier in people's perception as to whether they should seek out a test. No, you won't. You do have to have symptoms to qualify for a test because that's what we're seeking out. So that's an important part, and Sean's already explained those symptoms.
I'll just add to that. What we have seen where we've done some specific community surveillance, like in Queenstown last week, we had the pop-up and over 1,000 people were tested. Not all of those people were symptomatic. The test was free, but what we were trying to do there was just check and see that there was no infection in that community, which was the case, which is good. So there will be occasions when we're doing that surveillance testing where asymptomatic people can be tested, and in that case it will be free. Thanks very much, I appreciate the questions, and we'll just move on to the next feature in today's show. Thank you. Right.